Today I'll be discussing the popliteal fossa. So the popliteal fossa is a diamond-shaped space located on the posterior aspect of the knee joint. So as you can see here, this is the femur and this is the tibia and this is the knee joint. So the popliteal fossa is located just behind the knee joint. So the popliteal fossa allows neurovascular structures to pass from the thigh to the posterior aspect of the leg. Now let's start by discussing the borders of the popliteal fossa. So this diamond has upper borders, two upper borders, and two lower borders. So the upper lateral border right here, because this is the lateral side, is formed by the biceps femoris muscle, this one. The upper medial border right here is formed by two muscles. The first one is the semitendinosus and the second one is the semimembranosus. Now for the lower border, the lower lateral border, it's formed by two muscles. The first one is the lateral head of gastrocnemius, and the other one is a small, tiny muscle called the plantaris. The medial lower border is formed by the medial head of gastrocnemius. Now, let's discuss the contents of the popliteal fossa. Now I'm going to mention the contents from deep to superficial. So the deepest content of the popliteal fossa, which is near the floor, is the popliteal artery right here. And the popliteal artery is the continuation of the femoral artery. If you remember, the femoral artery was in the thigh and it reaches the popliteal fossa by passing through this opening, the adductor hiatus. And then once it reaches the popliteal fossa, it becomes the popliteal artery right here. After the popliteal artery, we have the popliteal vein. Now moving to the nerves. As you remember, the sciatic nerve runs on the posterior aspect of the thigh, and once the sciatic nerve reaches the popliteal fossa, it splits into a medial branch and a lateral branch. So this one is the medial branch, and it's called the tibial nerve, and this one is the lateral branch, and it's called the common fibular nerve. It's also known as the common peroneal nerve. As a content, we also have some lymph nodes and some fat. Now moving to the roof of the popliteal fossa. So the roof starts with the skin. After the skin comes the superficial fascia, and then we have the deep fascia. Now let's talk more about the superficial fascia because it's special right here. It contains some important cutaneous nerves as well as a superficial vein. So the superficial vein, we have one superficial vein, and we have three cutaneous nerves. Starting with the vein, if you can see this vein right here, which empties into the popliteal vein, this vein is called the small saphenous vein, and it runs on the posterior aspect of the leg upwards, and once it reaches the popliteal fossa, it pierces the superficial fascia and the deep fascia to empty into the popliteal vein. Now we are done with the vein. We are left with three cutaneous nerves in the superficial fascia. So the first one is this one. Okay, so this one is called the posterior femoral cutaneous nerve, also known as the posterior cutaneous nerve of the thigh. If you remember, this is a branch of the sacral plexus, and it supplies or provides cutaneous innervation to the posterior aspect of the thigh, as the name suggests, and it terminates in the popliteal fossa. As you can see, those are the terminal branches of the posterior femoral cutaneous nerve. Now we are left with two more cutaneous nerves right here. The first one arises from our tibial nerve, and it's this one right here. It's called the medial sural cutaneous nerve, And if you remember, the tibial nerve was the medial branch of the sciatic nerve, so it's easy to remember that it gives rise to the medial sural cutaneous nerve. The last cutaneous nerve we have right here is a branch of the common fibular nerve. It's this one, and it's called the lateral sural cutaneous nerve. And if you remember, the common fibular nerve was the lateral branch of the sciatic nerve, so it also gives rise to the lateral sural cutaneous nerve. So, in the superficial fascia, we have one vein, the small saphenous vein. We have three cutaneous nerves. They are the posterior cutaneous nerve of the thigh, which terminates here. This one is also part of the posterior cutaneous nerve of the thigh. We have the medial sural cutaneous nerve, which arises from the tibial nerve, and we have the lateral sural cutaneous nerve, which arises from the common fibular nerve. Now we have discussed the roof. Moving to the floor of the popliteal fossa, it's pretty straightforward. So we have the floor consists of a bone, a joint, and a muscle. The bone, the first bone, is the femur. More specifically, it's the popliteal surface of the femur, right here. Then we have a joint, which is the knee joint. More specifically, the capsule of the knee joint. And lastly, we have a muscle. It lies deep to the lateral head of gastrocnemius and to the plantaris. So if we remove them, we can see this beautiful joint here, beautiful muscle here, the popliteus muscle. This muscle also is part of the floor of the popliteal fossa, and the lower border of this muscle demarcates the lower border of the popliteus fossa. Now this is a table that summarizes what I have mentioned during this video. I hope it was useful. Thank you so much.